Hi, I am Aurel Enriquez, and this presentation contains our discussion on week 14. Here is the outline of our week 14 topics. Apat na viruses lang po ang pag-uusapan natin dito at 10 slides lang ang presentation nito. Let's proceed with parvoviride. Tingnan nyo, ang bilis, naka-slide 3 na agad tayo. Let's start with parvovirus B19. Now, the smallest DNA viruses are under the family Parvoviridae, which are naked SS or single-stranded DNA viruses. There could be other members within this family, pero parvovirus B19 po, yung principal pathogen under the genus Erythrovirus. Okay, so the disease associated with this one is the fifth disease, otherwise referred to as erythema infectiosum. Now, recall time. If parvovirus B19 causes the fifth disease, ano naman po ang causative agent ng sixth disease? It's the human herpes virus 6, all right? So patients with erythema infectiosum would experience fever, headache, malaise, and myalgia, which are very non-specific. And sometimes there may also be respiratory and gastrointestinal symptoms such as nausea and vomiting, which is also non-specific, all right? But after the prodromal phase or yung simula na yun, the rashes would appear in a pattern that is referred to as the slap cheek appearance, as we can see right here on this photo to the right. Okay, take a good look at this photo to the right. Now, does anybody watch Grey's Anatomy? May nakapanood na ba ng Grey's Anatomy? Not the new ones. The older ones, yung sobrang luma na, yung seasons 1 hanggang 5. Kamukha nung bata, si George O'Malley. Okay, so ayun po, that's the first thing that came to mind when I saw this photo. Alright, so ang target host cells po ng parvovirus B19 ay yung mga erythroid progenitor cells. So these cells have receptors for the virus. So parvovirus B19 viremia could cause transient aplastic crisis or a self-limiting erythropoietic arrest. Alright, so that kind of makes sense, right? Kasi kung ang apektado ay yung mga cells that are responsible for creating new RBCs, then we could expect that there would be a decreased RBC production in the bone marrow because of this infection. Next, in 2005, a novel parvovirus was described, and this was the human Boca virus. Okay, so medyo bago pa yung human Boca virus, 2005 lang siya naging clinically significant or na-discover. So the human Boca virus was able to cause various upper and lower respiratory tract illnesses. Now, the clinical symptoms would include coughing, rhinorrhea or runny nose. Also, there's fever, difficulty breathing, diarrhea, conjunctivitis, and rashes. So, ang dami niyang pwedeng clinical manifestations, but again, they're so non-specific. Now, the virus may be shed in high quantities in stool, which could be correlated to the fact that this could also cause diarrhea. Also mentioned here is that it is usually found as a co-infection with the respiratory syncytial virus and the human metapneumovirus. Next week pa po natin i-discuss itong mga to. Alright? But ayun nga po, keep in mind that human Boca virus infections could usually go as a co-infection. So meaning, silang tatlo, magkakatropa sila, magkakasabay silang i-infect nila yung mga patients. Alright? So that's what we mean when we say co-infection. A person being infected with multiple different viruses at the same time. Alright? So again, the human Boca virus could cause a co-infection together with RSV and the HMPV or human metapneumovirus. Let's proceed to the family Rheoviridae. Rotaviruses are naked, double-stranded RNA viruses that belong to the genus Rotavirus. So rotaviruses are the most common cause of viral gastroenteritis among infants and children. Okay, so keep that in mind, no? Hindi naman po sinasabi nito na hindi na nito kayang magdulot ng gastroenteritis among adults or older people, no? It's just that it's more common, or it's actually the most common virus for infants and children that could cause gastroenteritis. All right? So, ayan po, no? By the fact that this could cause gastrointestinal infections, the mode of transmission is through the fecal oral route because the virus particles could be shed in the stool. All right? So incubation period is within 1 to 4 days. So medyo mabilis po yung development ng disease. So symptoms would generally occur suddenly, and it would include vomiting, diarrhea, fever, abdominal pain, and even some respiratory symptoms. Okay? So ang target cells po ng mga rotaviruses are the epithelial cells in the tips of the microvilli of the small intestine. Okay, as we can see right here in this bottom left picture. So, the microvilli, what would happen to them is they are stunted. Okay, so kumbaga is maapektuhan yung structure nila, and absorption is reduced. Okay, so when we say stunted, it means that the cells would fail to grow or develop properly, and since hindi po nag-develop ng maayos yung mga cells, no? Hindi rin po nila na magagawa ng maayos yung primary function nila, which is to absorb water and nutrients. All right, so that is why absorption is reduced. The Colorado tick fever virus belongs to the genus Cultivirus. So this is an arthropod-borne virus that could cause a dengue-like infection. All right, so take note of that, ha? Medyo similar daw po, may similarities, no, yung infection with the Colorado tick fever virus in comparison to the dengue virus. Kaya po siya tinawag na dengue-like infection. Now, the specific vector that is involved is the Dermacentor andersoni, as we can see right here in these bottom right photos. Okay, so ayan po, no, again, yun yung mga bagay na hindi natin dapat kalimutan. Again, arthropod vector for the Colorado tick fever virus is the Dermacentor andersoni. Clinical manifestations would resemble dengue, all right, or it leads to a dengue-like infection. So that would include fever, chills, muscle pain and joint pain, or myalgia and arthralgia, and meron din pong photophobia, meaning increased sensitivity to light. So parang nakakairita or mabilis masilaw, no? Nakakairita yung ilaw or mabilis masilaw yung pasyente, no? So that's what we mean when we say photophobia. Okay? So ayun po. Eventually, this infection could progress to hemorrhagic fever. Okay? So, pwede ring magtuloy-tuloy yung infection, magkaroon ng hemorrhagic fever yung pasyente. The rashes may also be similar to those that we see during dengue cases. Okay? So, magkahawig daw po yung rashes na nakikita natin during cultivirus infections and yung rashes from those that are infected with dengue. Here are the references that were used in the making of this presentation, but again, huwag pong kakalimutan, ang main reference pa rin natin, and ang sinusunod natin sa lahat ng quizzes, shiftings, and major exams ay Mahon 7th edition. This has been Aurel Enriquez. Kung hindi ka pa nakaka-subscribe, mag-subscribe ka naman. Tulungan mo naman akong ma-monetize. Thank you so much for watching.